Pregnancy and lactation. Presentation by Jasmine Kaur and Manna Meron Biju. Introduction. Nutrition requirements increase tremendously during pregnancy and lactation as the expectant or nursing mother not only has to nourish herself but also growing fetus and the infant who is being breastfed. Energy requirements during pregnancy and lactation. There's an ideal diet that a pregnant lady should follow. For breakfast, she must include a combination of fruits and vegetables like apple, beetroot, celery, pineapple, pear, orange, and ginger. She should also include boiled or scrambled eggs with whole grain bread, butter, milk, and cereals. Recommended lunch for a pregnant woman mainly include carbohydrates. So, she should have rice or pasta with roasted vegetables and chicken. Mashed potatoes can also be included in the diet. Having vegetable soup at least 4 times a week is highly recommended. During dinner, she should have poached salmon or any other seafood with brown rice and green vegetables like asparagus or broccoli. Pregnant women need more energy than that of a normal woman, so eating snacks like smoothie, guacamole, crackers with hummus or cream cheese, fresh fruits and vegetables is a necessity. Drinking lots of fluids is also recommended for a pregnant lady as she has to excrete the fetus waste along with hers. Essential nutrients during pregnancy and lactation. Calcium. It is necessary to strengthen the bones and teeth of baby as well as the mother. It also helps circulatory, muscular and nervous system to work normally in the mother. It is so because the mother undergoes both physical and emotional changes during pregnancy and lactation. Good sources of calcium are dairy products, broccoli, kale, fruit juices and breakfast cereals. At least 1 cup of milk twice a day is recommended to be included in the diet during lactation. Iron. Our body uses iron to produce hemoglobin, which facilitates the transport of oxygen throughout the body. So, during pregnancy, the woman should double the amount of iron in diet than that of a non pregnant woman, so that her body produces more hemoglobin to supply sufficient oxygen to the fetus during pregnancy. If the lady doesn't have enough iron in her diet, she could develop a deficiency disease, namely anemia, which could even lead to fatigue. This could also lead to the risk of premature birth, having a low birth weight baby, and postpartum depression. Good sources of iron include lean red meat, poultry, fish, beans, and other vegetables. During lactation, baby doesn't get enough iron from mother's milk, so it's necessary to consult a physician for giving iron supplements to the baby. Protein. It is the nutrient that is crucial for fetal development throughout pregnancy. It helps in the formation of antibodies for the immune system, hormones, and enzymes. It is also important during lactation as it helps with the production of milk to nourish the baby. Good sources of protein are lean meat, fish, eggs, poultry, beans, peas, nuts, and soy products. Folic acid. It is the synthetic form of vitamin B, that is folate found in supplements and fortified foods. Having folic acid supplements before conceiving and during pregnancy is found to decrease the risk of premature birth and defects in the baby's brain and spinal cord. Good sources of folic acid are cereals, leafy greens, citrus fruits, and dried beans. Vitamin D. It promotes the bone strength of both mother and child. It also reduces the risk of underweight and premature birth. Good sources of vitamin D include sunlight, fatty fish such as salmon, and fortified drinks like milk and orange juice. Infants require vitamin D to maintain a good skeletal integrity. Use for pregnant women. To take multivitamin during pregnancy, the requirements for prenatal vitamins are higher, as they contain those vitamins needed by pregnant women. A multivitamin usually contains DHA, APA, or both. These are required for the proper brain development of the fetus. However, taking more than the maximum limit is not recommended, as vitamins in higher amounts could be harmful to the baby. Secondly, do workout. Regular exercises can prevent insomnia, muscle pain, excessive weight gain, and mood swings during pregnancy. Thirdly, getting a flu shot is very important, as it reduces the risk of side effects following an influenza. This vaccine will protect both mother and fetus. Last but not the least, to eat seafood. Seafood is loaded with vitamins, minerals, omega 3 fatty acids, zinc, and iron, which are important for both mothers and child's health. However, it's recommended to avoid eating raw fish and undercooked fish and fish that may contain high levels of mercury. Don't S for pregnant women. Do not smoke. Babies born to women who smoke during pregnancy are more likely to be born with lower birth weight and has a greater risk to learning disabilities. Children born to women who smoke during pregnancy are more likely to be early smokers due to physiologic nicotine addiction. Secondly, avoid alcohol. Women who drinks alcohol while being pregnant could deliver a baby with fetal alcohol syndrome, which could lead to low birth weight, learning disabilities, behavioral disorders, and lagging patterns in terms of growth and development milestones. Even small amounts of alcohol can be dangerous, so it's better to stop drinking alcohol while being pregnant. Thirdly, do not drink a lot of caffeine. Because caffeine will travel through the placenta and increase the fetal's heart rate. 1 or 2 cups of coffee is the safest amount one woman can consume during pregnancy. And at last, avoid raw meat. Having raw and undercooked meat and eggs while being pregnant carry the risk of foodborne diseases like listeria and toxoplasmosis, where food poisoning is also a possibility. These conditions can cause life threatening illnesses, severe birth defects, and even miscarriage. Summary: always consult a doctor during pregnancy. Follow the diet plan given by a dietitian. Fill the surrounding environment with happy vibes and people who help reduce stress. Thank you for watching the video. Hope it is useful for you. Thank you for watching the video. Hope it is useful for you.